Hi guys, okay, welcome to Thursday. It's me, Heidelbergerin. Today I want to talk to you about PCOS, which is polycystic ovarian syndrome, and I'm going to have to fly through my information because I've kind of done this video 3 times and I can't get it under 10 minutes. So the reason I'm talking about it is because I suffer from PCOS, so this is basically, a lot of this information has come from my own research, learning about the condition. So polycystic ovary syndrome is basically the name given to a condition in which women with polycystic ovaries have one or more additional symptoms. Now, it was first discovered in 1935 by 2 doctors called Dr. Stein and Dr. Leventhal, and for a very long time was known as Stein-Leventhal syndrome because of them discovering it. So the term polycystic ovaries basically describes ovaries which contain small cysts, which are about, twice as many as you would normally find on healthy, normal ovaries. And usually these cysts are no bigger than sort of 8 millimetres, so we're talking, less than a centimetre. And they're located just below the surface of the ovaries. And what these are, the cysts are actually egg-containing follicles which haven't properly developed due to a number of hormonal abnormalities and imbalances. Now, polycystic ovaries are very common and they affect about 20% of women in total. Now, polycystic ovarian syndrome is actually very common as well, affecting about roughly 5 to 10%. And this is something that is worldwide. It's very prevalent in the UK, but it's everywhere in the world, basically. It's hereditary and can run in families. It's one of the leading causes of fertility problems in women. And if it's not properly managed, then it can potentially lead to further health problems in later life. And also, it can affect our appearance and the way we feel about ourselves. So it's important that we get a grip on this and we put the information out there basically and people know about it, because it isn't something that people tend to talk about too much. Now, one thing to bear in mind is that at the moment, although PCOS is treatable, there is no cure for it. So let's go through some of the symptoms of PCOS. Now, PCOS basically affects every woman differently. So some people may have a wide range of symptoms with varying degrees of severity, and some may just have a couple of symptoms and quite mild. So it does vary from case to case. But basically some of the symptoms can include things like irregular periods or completely lacking, not having any periods at all, irregular ovulation or again not ovulating at all, reduced fertility, difficulty in carrying, if you're pregnant, carrying full term, recurring miscarriages, difficulty becoming pregnant in the first place, hirsutism, so unwanted body hair basically, maybe on the face or legs or wherever, suffering from oily skin and acne and just general skin problems, developing alopecia, so thinning hair or hair falling out, also weight problems, so being overweight, putting on lots of weight really quickly, having problems shifting the weight and losing the weight again, and also depression and random mood swings. So what causes PCOS really? Now, the symptoms of PCOS are associated with abnormalities in some of the hormones that control the menstrual cycle, and these abnormalities typically include higher than normal levels of LH and androgens and below normal levels of FSH and progesterone. Now, the most important androgen is testosterone, which is produced by all women from the ovaries. Testosterone is normal, it's an essential product of the ovary because most of it's converted within the ovarian follicle into estrogen, which obviously is the main female hormone. Now, women with PCOS basically produced higher than average amounts of testosterone from the ovaries, and this is sort of what results in many of the symptoms or contributes to many of the symptoms of the condition. Now, testosterone is usually considered to be a male hormone, but this isn't true. Every woman produces testosterone. What happens with women with PCOS basically usually have a testosterone measurement that's either slightly higher or slightly above average than the the normal female range, or is at least in the upper bracket, if you like. Now, it's also thought that another hormone, insulin, may well be involved in the development of PCOS. Now, insulin is the hormone that is created or produced by the pancreas, and it is produced in order to regulate the level of glucose in the blood. Now, many women with PCOS are found to be suffering from a condition called insulin resistance. And insulin resistance basically means that the body's tissues are resistant to the effects of insulin, and particularly on the ability of insulin to get glucose into muscle tissue. So basically the body has to produce more insulin to sort of counteract this and to compensate. And it seems that these high levels of insulin then affect the ovaries, which then contributes to the abnormal hormones generally. Now, sadly, doctors aren't yet fully in the know about what causes these hormonal abnormalities to begin with, and it may be that there are several causes which explain why, you know, different women suffer from different aspects or different symptoms. And there's a lot of research still going on into this, but it's currently thought that there is a hereditary link, whereby, you know, some women will have a greater chance of developing PCOS, but whether or not these women actually do develop PCOS still depends on a number of additional factors, such as things like diet and exercise and general lifestyle. So just quickly, I wanted to go over some of the potential health risks of PCOS. Now, women with PCOS who have insulin resistance have an increased risk of developing type 2 diabetes, which is the non-insulin dependent diabetes. And this is much more likely to occur in women who are overweight, but can also develop in women of a healthy weight range. Women with insulin resistance may also be at risk of developing heart disease in later life. However, although risk factors for heart disease may be increased with PCOS, there isn't yet any clear evidence that heart attacks are more prevalent in women with the condition than those women who don't have PCOS. And, excuse me, to be honest, the risks of developing heart disease can be largely reduced by preventative measures such as eating right and exercising well. Now, just to go over treatment, as I said before, there is no cure for PCOS. So the medical treatments that are out there at the moment are actually aimed at assisting or alleviating the symptoms. So they will treat the symptoms but not necessarily the cause, because obviously the cause is still unknown. Now, personally, I take 500 milligrams of metformin 3 times a day, and this is to assist with my insulin resistance and to try and regulate the hormones generally in my body. Now, it should assist me also with losing weight. Now, another thing that it's been recommended to me that I do is follow a low GI diet, and obviously exercise. So, basically, I've just given you an overview of what PCOS is. What's going to happen now with my slots, hopefully, over the coming weeks, is I'm going to track my progress. I'm going to start following a low GI diet. I'm going to do weekly weigh-ins so I can see what's happening with my weight. I'm going to take my metformin religiously, and I will be keeping a food diary, because it's amazing how much stuff you actually put into your mouth when you're not, if you have to write it down, it's just, it is amazing how much stuff you just accidentally slip in there. So this is what I'm going to be doing, and I'm going to keep checking in with you guys, and we're going to monitor this. And yeah, I'm going to be doing some recipes, testing out some exercise stuff that you can do, so keep watching. But I hope you found this little overview of polycystic ovarian syndrome of interest, at least, and possibly of use. If you've got any questions, please send me a personal message to my Heidelbergerin username, and I will do my best to answer anything in full. And if you have any video requests, of course, let me know. Okay guys, thanks very much for watching. Speak to you soon. Bye!